Okay, you've described your symptoms as nasal congestion, nasal discharge.
The patient described her symptoms as nasal congestion, nasal discharge, and facial pain and pressure. Because she had had these symptoms for at least 1 week, it indicates that she has acute bacterial sinusitis. The doctor prescribes the antibiotic Zithromax One, and even though it is only 1 dose, the drug stays in the body for up to 10 days.
This is only taken 1 time. It should be taken on an empty stomach and within 12 hours. Remember to shake it well before you take it. Also,
the pharmacist says that Zithromax One is to be taken 1 time. It should be taken on an empty stomach and within 12 hours. He tells her to shake it well before she takes it, and that it works over time to clear up the infection, so she might not feel better right away. Zithromax One has been studied in mild to moderate respiratory tract infections, including acute bacterial exacerbation of chronic bronchitis, community-acquired pneumonia, pharyngitis, tonsillitis, and acute bacterial sinusitis due to susceptible pathogens. Azithromycin is embedded into microspheres, which allow for delivery of a complete course of therapy in a single dose. The microspheres minimize release of azithromycin in the stomach, thereby minimizing GI side effects. Instead, they pass through the stomach and into the small intestine, where the active ingredient is slowly released. Diffusion through the pores of the microspheres allows slow release of azithromycin and absorption into the bloodstream. The cellular components of the blood include the red blood cells, platelets, and white blood cells. One type of white blood cell, the neutrophil, is the first line of defense during a bacterial infection. Its job is to seek out and destroy invading pathogens. The neutrophil first engulfs and internalizes the pathogen by a process called phagocytosis, then subsequently digests and kills the organism. Azithromycin readily enters and is highly concentrated within neutrophils, which actually serve as a targeted drug delivery system. During an infection, azithromycin-laden neutrophils are attracted to the invading bacteria, and they leave the blood vessel and migrate to the site of infection. Here, phagocytosis occurs. The neutrophil surrounds and engulfs the bacteria and subsequently destroys them. At the same time, the neutrophil releases high concentrations of azithromycin in the surrounding tissue and fluids, making additional drug available for the killing of extracellular bacteria. Azithromycin works by inhibiting bacterial protein synthesis, causing the bacterial cell to die. Neutrophils serve as a targeted drug delivery system, enhancing tissue concentrations at the site of infection. Zithromax One is an innovative new single-dose liquid antibiotic for the treatment of mild to moderate respiratory tract infections, such as acute exacerbation of chronic bronchitis, community-acquired pneumonia, pharyngitis, tonsillitis, and acute bacterial sinusitis due to susceptible pathogens. Zithromax One microspheres make it possible to deliver a front-loaded single dose with zithromycin that significantly increases drug concentrations earlier in the course of infection, when the bacterial burden may be at its highest. The single-dose nature of Zithromax One also makes it an easy therapy for patients to complete. In the pivotal trials, 100% of patients treated with Zithromax One completed therapy. Zithromax One has been studied for the treatment of the following mild to moderate respiratory tract infections in adults. Zithromax One is a well-tolerated single-dose therapy. In clinical studies, the majority of side effects occurred in the GI tract, were mild to moderate, and resolved by day 2 for most patients. Overall, the most common side effects of Zithromax One are diarrhea, loose stools, nausea, abdominal pain, headache, and vomiting. Zithromax One is contraindicated in patients with known hypersensitivity to azithromycin, erythromycin, or an immaculide or ketolide antibiotic. Zithromax One, 1 dose, 1 time.